is a registered dietitian. So we are going to go through some information that we hope is really helpful to you as service providers servicing a lot of our community members. We do have a chance for questions and answers at the end. So please, if you need to jot them down, if you want to put them in the chat box as we go, that works. And thank you to those who submitted questions along with your registration. We use that. We built a lot of the answers into the presentation, we hope. And if not, then please feel free to ask this in the question at the end. So I'm going to get started. We will go through a little bit of general COVID-19 information, just some basics about the virus and the disease itself. We'll then get back into a little more detail about school cases, especially in students. Karen Fields is going to walk through what happens when there's a positive case, how they talk to people, what kind of contact tracing they do, all those sorts of ins and outs of a case investigation. And Mariel's going to help me along with the COVID information and then also some extra resources that we know of in the community as well, that we hope that you can promote to your clients. So we will get started. So I won't spend a lot of time on the basics of COVID-19 because it's not super new anymore. But what it is, it's a virus that infects the lungs and the airways. It spreads between people, and it can cause mild to severe illness. We do see very big differences from person to person in terms of what sort of organs it affects and how mild or severe the symptoms can be. The only way to know if you have it for sure is to be tested. So a positive test that is run from the lab, that is the only way to for sure say that you definitely have a positive COVID case. At this point, the long-term effects are not known. This disease is still relatively new. The medical system is still learning. We see that very often. We know that it causes a lot of frustration and confusion in our community, and across the world. As we learn more, some of our protocols and suggestions and information might change, but that is really just because it is a novel virus. The common signs and symptoms of COVID-19, the most common ones include a fever, which is above 37.8 degrees Celsius, a new or worsening cough, and shortness of breath. So that's in light of the fact that it is usually a very primarily respiratory disease. Other symptoms may include sore throat, runny, stuffy nose, body aches, fatigue, a lot of very similar symptoms that you would see with a common flu or a cold, because they are also coronaviruses as well. So coronavirus with COVID-19, that is not the only type of coronavirus that exists. So that's why a lot of the symptoms cross over, and it can be really hard. You do have to have that positive lab test to say conclusively that you have COVID-19, because a lot of these symptoms do cross over to other illnesses as well. So there are a number of infection prevention steps that we have. These are the sorts of things that you hear health unit coming from the Ministry of Health. So what they are and why we do them. So number one, hand washing with soap and water or using a hand sanitizer. This is to wash the virus off your hands. So if you've maybe touched a surface with it, or if you've coughed or sneezed into your hands and you have the virus, you really want to wash off well with that soap and water or an alcohol-based sanitizer to get the virus off of your hands. That helps prevent spreading it to other people should you touch, if you shake their hands or touch something else on another surface like a doorknob or a light switch in your house. Wearing a face mask. So this is something that we're seeing, we're very used to now. So the reason that we wear a face mask is to help limit the amount of respiratory droplets that can leave your mouth or your nose. Not only just if you're coughing or sneezing, but even breathing and talking, we do expel droplets with all of those actions. So wearing that face mask is a barrier to help prevent those things from spreading to other people. And along with that, keeping that physical distance. So the scientists do know that the droplets that can be expelled from your nose or your mouth with the coronavirus on them generally do not travel further than 2 meters just because of how heavy they are. So by keeping that physical distance between people, those droplets are less likely to reach from you to others or from others to you. Last one we're going to talk about here is limiting contacts. So right now we are under some pretty strict protocols from the government with the stay-at-home order. they also dictate how many people you can spend time with socializing indoors and outdoors because they're different. Right now, there's no socializing. We limit those contacts just because then there's fewer people that you could potentially spread the virus to. I'm sure Karen might get into this a little bit later, but when they're doing contact tracing of a positive case, if you think about if one person has 10 close contacts they've spent time with, that's 10 people that public health has to get in touch with to talk about monitoring symptoms and being careful, versus somebody who might have only spent time with 1 or 2 contacts. It's just a much smaller potential chain of infection. So this is why right now really limiting contacts is an important factor. When we get specifically into schools, again, because the 3 of us work on the school team and that is our primary focus, that's what most of this is going to be talking about. There are a few extra things that the Ministry of Education and the health unit have in place. Right now, we know schools are out and they're doing online learning, but when they were in person, or when they go back to in person, they were doing daily symptom checks at home. So there was an online tool or paper-based tool that students had to check off every day, went through a symptom check. This was really just done to prevent any ill student from going to school. They might have had COVID-19, they might not have, but in order to just protect everybody else, anybody with any sort of symptom was advised to not go to school. Masks use by all students grades 1 through 12, again, just using that mask to help reduce the transmission of any sort of droplets. Class cohorting. So they reduce the number of cohorts or number of contacts that a student has, where students might have changed classrooms or changed people that they were in class with throughout the day. They have stopped doing that so that they always know exactly who a student might have contact with, just so that if they needed to do any sort of contact tracing, it was much easier and there was a lower number of contacts for each student. Assign seats on the buses. This also helped to assess any sort of contacts that might have come up. We could tell how high risk a person might be based on how close they were sitting to a positive case on the school bus. It also just helped the bus driver know who was there and who wasn't there on a particular day. When you see HRCC in some of our slides, that stands for high risk close contact, which will be talked about a little bit more. And asymptomatic testing. So this is the final piece in prevention that was specific for schools. We did run a couple of asymptomatic testing events at schools, and then numerous schools were invited to attend. This was to help identify any cases before it spread widely. So these were being tested. These were students, parents, and even teachers who did not have any symptoms of the illness, but they were doing testing to find out if they had the virus with no symptoms, just to help prevent spread it before it got too wide. And then I believe Marielle is going to take over at this point.
Yeah, sorry, I was just waiting for the slide to change on my screen. As Ashley mentioned, there is one of the most important prevention strategies and guidelines have been introduced in the school is to do a daily symptom check. This will when the users go and online, this could be done online. It's specifically to school. It's a school screening, and it'll tell them if they are able to come into school for in-person learning. So this is used when the schools are open. Right now the schools are closed and kids are doing online learning, but when they're open, they are asked to do this every morning. It is available as an online tool, as well as a paper version that's also available, and it can be downloaded in a variety of languages. We've heard from different schools and different principals that they will actually have the paper version available for families to pick up and take home. So some schools will have that available. For the secondary students, they actually have to show proof that they've passed the daily symptom check. So it's something that they must do every morning. Next slide, Ash. So another resource that the health unit has put together, we have a handout, what to do if your child has symptoms of COVID-19. So once the family uses the daily school screening, they'll be able to tell what to do if it says that they can't go to school because of any symptoms. So at the beginning of the school year, there were sort of tiered of symptoms, ones that were more common, and school kids were able to go to school 24 hours if those symptoms disappeared. And then there were the most of concern, which were more like a fever, and those were for sure kids had to get tested, or they had to go through the whole ordeal of getting either tested or an alternative diagnosis from a healthcare provider. Early in February, the guidelines were changed, and now any symptom has to go through this journey of either getting alternative diagnosis by a healthcare provider, or getting tested, or staying home if the family can't get a diagnosis, or chooses not to get the child tested. It's very important to note, it's a question that we've been getting a lot from families, that the rest of the family doesn't have to get tested. So if a child has symptoms, only the child has, or the person with symptoms has to get tested, not the rest of the family. And it's something similar, and Karen will talk a little bit about it as well. When a kid gets dismissed from school from a potential exposure to COVID-19, the rest of the family doesn't have to get tested if they're not symptomatic. And in fact, we've had many families who have made an appointment at the assessment center to get tested, and they've actually been turned away because they didn't meet the requirements for getting tested. Next slide. So another guideline that was introduced, it was to prevent the spread of COVID-19, especially with the variants of concerns that we've been seeing more and more in our community. One was specific guidance for families, depending on whether or not the student was dismissed student was symptomatic or not. So if a dismissed student, or so a student who was part of a cohort where there was a COVID-19 identified and they were potentially exposed to the virus, if the child wasn't symptomatic, so was asymptomatic, the family was advised to stay home and only leave for essential reasons. And that included going to get groceries, going to work. The siblings could go to school, but absolutely no social gathering. So anything outside of leaving the home outside of being essential was not recommended. That has changed a little bit now with the lockdown measures, because we're all supposed to be staying home. But that's the recommendation that our case investigators give the families when a kid is dismissed. The story changes a little bit when the child becomes symptomatic. That's when everybody in the household is directed to stay home, and they can only leave for medical if they're seeking medical attention. And in that case, the student is recommended to get tested for COVID-19. And depending on the results and what the family gets, they'll be given further advice and further guidance of whether or not they can leave the house and continue to stay home only for and leave only for essential reasons, or if they also have to isolate depending on whether or not the child tests positive. Next slide. So we wanted to talk a little bit about what our school team, our department looks like, and how we've shifted a little bit of our workforce to support COVID in school. So before COVID, our team worked directly with schools. So we have a team that is comprised of a variety of health professionals. Mainly, we have public health nurses, and before COVID, each nurse was assigned to. They had a caseload of around 7 to 10 schools if they were deemed high priorities, if they were serving certain neighborhoods, and then up to 20 schools under the caseload if they were in neighborhoods that were deemed as lower needs. But they worked very closely with the principal and with the school community to promote health and support them in any of their health needs that they would have. When COVID hit, we pivoted our work to support a lot more of the case and contact management work, but still working with the schools that were initially assigned, and very closely with the principal and with the school community to be able to support any COVID related work that came in. We have the opportunity to have specific language speaking nurses. So we have 2 Arabic speaking nurses, and they work primarily with the schools that have a high population of Arabic speaking families. And then we have 2 French speaking PHNs that work mostly with the schools under the French boards. And then lastly, we have a health promotion specialist, which is Ashley, and then a registered dietitian, which is myself. So with COVID, we've pivoted our work to do more of the health communication initiatives, so making sure that our website is always up to date with the latest guidelines, that we have different languages available for the fact sheets and the resources that we put out, and that everything is always up to date, and that and the families have access to the information as it comes out. And now, next slide. Karen Fields is going to be talking a little bit more about what we do once a positive COVID-19 case is identified in our community in a school-aged child.
Okay, so hi everyone, can you hear me okay? Okay, good, thank you. So I'm one of the school nurses, and a big part of what I do is basically follow up on all of these positive cases that show up in schools, so that we can notify parents and school communities when that happens. So every single person in Windsor and Essex County who tests positive for COVID-19, the health unit is notified of that result. So if it turns out that it's a school-aged person, or if we know that it's a person who works in a school, that person is going to be assigned to one of the school nurses, who will then do a very thorough investigation or interview with that person, just to determine if anyone else in the school could have been exposed to them while they were sick. So a lot of the questions that we ask, and this interview can be quite detailed, it can take 30 to 45 minutes depending. The questions that we ask, we're going to ask them, so, why did you get tested? Have you been in contact with someone who's positive? Are you having symptoms? If so, what are your symptoms and when did they start? And then we get into the school piece of it, where what school do you attend? What grade? What teacher? When was the last day you attended school? If it's a child, we're asking about whether they ride the bus, if they're in before and after school programs, and what kind of PPE was worn. So we're really going to a very detailed interview with each of these people. Next slide, please, Ash. So basically what happens if there's a case that attended school. So the case investigator takes all the information that we accumulated when asking them, when were you at school? When were your symptoms starting? We look to determine what their infectious period is. So the infectious period means the time that that person was able to spread their COVID virus to other people. So those people who the person was able to spread the virus to would be considered high risk close contacts. So high risk close contacts are someone who spent time with a person who tested positive for COVID-19 at a distance of less than 2 meters from that person without wearing their PPE, or their personal protective equipment. So in general, if a positive student or staff was in a classroom, those kids in that class would be considered high-risk close contacts and be dismissed from school. If that student attended a before or after school program, those kids may potentially be affected as well, as will some of the kids on the bus if the child did ride the bus. Teachers and other educational staff in the school are assessed slightly different. And it's a common question, I'll get teachers who will call and ask me, they'll say, my entire class has been dismissed, yet I'm still able to come to school. So why is that happening? And the reason that happens is that Ashley mentioned that 2 meter social distance. That's one of the things we look at. Kids, pretty difficult for them to maintain and understand that 2 meter social distance, whereas teachers definitely can keep a distance from the kids. And they also wear different personal protective equipment. They wear medical masks. They also wear face shields or goggles, whereas kids in the classroom, they're wearing cloth masks and they don't have that other protection of goggles or face shields. So the health unit has a very strong partnership with the school. We work very closely with the schools to make sure that whenever there is a positive case of COVID identified, that the school and the school community is notified. That's done in a variety of different ways. It's done through letters that are sent home by the principal. It can also be through center voice messages or through emails or voice messages that come directly from the school. One of the big ways that we communicate with the school when a student has been exposed or is considered a high-risk contact for COVID is through the dismissal letter. So the dismissal letter is something that is a very important piece of information. And so I'm going to spend a little bit more time kind of going through the different aspects of the dismissal letter. I'm sorry, was that is that for me? No? Okay, sorry. Okay, so what happens when there is a dismissal in the school? So what happens is that when a person has tested positive, if they have attended school during their infectious time, the school nurse will notify the principal and say, okay, that this person was at school during their infectious time, and we're going to need to dismiss some students. So we talk about the students that would be considered the high-risk close contacts. So any students in the class, any staff, any kids that were on the bus, any kids in a before or after school program. And then the principal calls each one of these families and notifies the parents that they have to come to the school. They have to pick up their kids, and then they have to take their kids home to isolate. At that time, a dismissal letter is also, it's drafted by the health unit and sent to the principal, and the principal distributes this letter to all the parents. So if the parents, if the kids happen to be in school when the parents arrive, the principal will give them a printed copy of this letter. If it happens to be after hours or on the weekend, typically what the principal will do is email this letter to the family. Once the families are notified, after the kids are at home, they're isolating, the families of the affected students are knowing what's going on, then the rest of the school community is notified that there has been a high-risk exposure to COVID-19 in their school. What's very important here and causes a lot of confusion sometimes is that parents think when there's a high-risk exposure to COVID in the school, that means the entire school population is affected. And in fact, that is not the case. If a person did not receive a dismissal letter, or if they did not receive a phone call from the principal telling them that they need their child to isolate, those kids have not been affected by the exposure in the school. Next slide, Ash, please. So I'm just going to go now. The next few slides really talk a lot about the dismissal letter. And as I was seeing people join the meeting, I was thinking that this is an important piece of how I could see, helping some of our families understand the information that's in this letter. So what this letter is telling parents is that, yes, your child has been identified as having a high-risk contact with someone who has tested positive for COVID-19. So the very top of the letter, what you can see on this slide, there's highlighted information. It's going to tell the parents that their child needs to self-isolate up to and including, and the school is going to enter the date. So that's going to be the date that the child has to isolate until. So basically, if that date is today, which is April 27th, the child will be able to come out of isolation the morning of April 28th. It also will say to get tested for COVID-19 on or after the date that's entered there. That too is a very important piece of information. That date is 7 days from the last time the child had contact with the person who is positive. That testing on that date or after is going to give us the best indication of whether that child is going to test positive or negative from their exposure. Next one, Ashley, please. So self-isolation is the next piece of the dismissal letter. So what happens here is that we're telling people your child needs to self-isolate. The important part of this is that we really want to try to separate this child from the rest of their family members as best as possible. How we're going to do that is listed on the slide. So we want them, if they can, to sleep in their own bedroom, to have their own bathroom if possible. If those things aren't possible, then we give parents instructions. How can you have your child isolating in the home? So there's cleaning measures. We try to get family members to stay physically distanced, that 2 meters away from each other. We have face masks if rooms have to be shared, all of those things. Our goal here is if this student should turn positive or become symptomatic, we're trying to protect the rest of the family from becoming ill. So if possible, I mean, it's kind of hard, and we spend a lot of time on talking about isolation with parents, because especially if your child is very young, it's really tough to isolate from that child. So what we do recommend, if there can be one family member who can isolate with that child and be the sole caregiver, that way those two are isolating together. Should the child become ill or test positive, there's additional risk to that one family member as opposed to the entire household. So it might help to contain the virus that way. And something that was already mentioned earlier is about the household members, which is also a very common question from families whose child is isolating. They'll say, well, my child has to isolate, what about me? So if the child is not having any symptoms, meaning they're feeling well, things are going well, they feel good, no symptoms at all, the other family members can continue doing their essential things. They can go to work, they can go to school, they can go grocery shopping, but they're really only doing things that are essential. They're not doing anything that's just kind of, just for fun. It's essential purposes only, and they're doing that until their child has finished their isolation period. When that would change is if their child were to develop symptoms, then the entire household has to isolate until they get further direction from either public health or the hospital if the child goes for testing. The only time people would be leaving home during isolation is if they needed medical care or if they were leaving to get tested for COVID. Testing, anytime someone is identified as a high-risk close contact, testing is highly recommended, whether the person has symptoms or not. So again, if someone does not have symptoms, we recommend that they test on day 7 or later, which is the date that's on the front of this dismissal letter. If that child tests at day 7 or later and their test result comes back negative, that's a pretty good indication the child is negative. However, they have to still complete their 14 full days of isolation and continue to watch for symptoms during that time. If a child is isolating and develops symptoms and it's before day 7, we absolutely recommend that they get tested. So anytime there is symptoms, they need to get tested. So there are several testing centers, and there is information on the dismissal letter about how parents can make appointments for their kids to get tested. That's important to know as well. An appointment has to be made. They cannot just walk into one of these centers to get tested. They need to make an appointment. If families are having a hard time accessing a testing center, our health unit phone number is listed there. We encourage them to call to see if there is some way the health unit can assist with getting them tested. Monitoring for symptoms is another very important thing. Ashley covered the common symptoms of COVID when she first started talking. So they're all there they're all there in front of us. It's very important. Again, if a child develops symptoms at any time, please encourage families to get their child tested. At any time also, if someone is concerned about the symptoms that their child is having, it's very important that they reach out to their family doctor. If they don't have a family doctor, it's after hours, they can't get hold of the family doctor. If they feel they need to go to the emergency room or call 911, that's absolutely what they need to do. All they have to do at that point is just let the healthcare provider know that their child has been identified as a high-risk contact and is isolating because of COVID. What we really don't want to see is people being afraid to leave isolation to seek medical care. They absolutely need to do so if they're worried about themselves or their child. Although the child is isolating, they're watching their child for symptoms. They also should be watching themselves and any other family member for symptoms as well, and get tested if they develop. Next one. And then practicing good hygiene, that again is just a reinforcement. When people are living in a household together, if one person becomes positive, it is very easy to share that virus with others in the home. So just a good reminder about good hand washing, wiping down high-touch surface areas in areas of the home that people commonly share, like bathroom space and kitchen space, light switches, doorknobs, all that kind of stuff. And again, really trying to encourage families. In some living situations, it's very difficult to isolate. So if they can designate one family member who can isolate with that child in hopes of preventing spread to the rest of the family. Next, please. So this is the at the very bottom of the dismissal letter. So you'll see the school name will be entered in there as long with an investigation number and the date of exposure. School name, straightforward. The date of exposure is the last date that the student had contact with the person who tested positive for COVID. The investigation number is a number that's very specific to the school. That number, when kids are tested, the health unit is able to track the investigation number to know how many kids at that school got tested, to know if there's any other positive cases showing up at the school, to determine if maybe an outbreak is going to have to be called. So we do ask that parents take this letter with them to the hospital when they get tested, because the hospital will put that information onto the lab slips, which makes it very easy and helpful for the health unit tracking. So once a student they've been determined that they're a high-risk close contact, they've been dismissed from school, kind of wonder what happens then. So someone from public health will call that family to make sure the student is doing okay. So they're going to call and ask questions like, is your child having any symptoms? Is isolation going okay? Do you have any questions? So they're calling really as a check-in. Those calls typically happen about 3 times during the isolation period. So usually within the first 2 days, they will call, see how it's going. They'll call midway through the isolation period, and then also at the end as a reminder that, okay, tomorrow you can return to school if you're feeling well, or if you're not feeling well, they'll give further direction from there. So it's nice, sorry, Ashley, I wasn't quite done. Just if parents to know that they can expect to get a call from someone from public health, because the number may pop up on their phone and they might not answer it. And it really is important that someone from public health make contact just to make sure that the child is doing well and the parents don't have problems. Also important for parents to know is that the number that we're going to give public health to call or contact is the one they have on file with the school. So if they don't have a current phone number on file with the school, it'll make it very difficult to get a hold of them. So again, if parents can even just every now and then check in to make sure their contact information with the school is current. So there are basically two types of dismissals. There can be a cohort dismissal, which means someone from a class, from a before or after school program, from a bus, somebody has tested positive. So one person has tested positive. And now as a result of that one person, as a precaution, we're discharging any of those kids who may have been close contacts and watching them for a period of 2 weeks to see if they develop symptoms. An outbreak happens when there's two or more students who are positive, they're in the same school, so there's a connection between them, and we think that maybe one of those kids became infected while they were at school. If that happens, that's considered an outbreak. So in terms of communication, parents would be notified that yes, there's been an outbreak at the school. The care of the student would not change, but what might change for those people is the length of time they're in isolation, the date that they require testing, and the date that they're eligible to return to school. Once, if an outbreak has been declared by the health unit declares the outbreak, the first people to be notified are the ones that are affected. And then once those families are notified, then a message goes out to the greater school community saying our school is now in outbreak, and they are going to recommend that everyone who's part of the school screen themselves for symptoms before coming to school. Next slide, please. So Ashley touched on this a little bit when she was speaking. So you've probably been hearing a lot about it now because it seems like it's a lot in the news. They're talking about variants of concern. Sometimes they call them VOX. These variants of concern are viruses that have changed. So the COVID-19 virus that we were looking at maybe last year at this time is starting to look a little bit different. And we know that there are several different types of variants around now. Variants are definitely concerning because they spread far more easily than the initial, I guess, the original COVID virus that we were aware of, and they can cause more severe illness. So here locally in our community, we definitely are seeing more cases that are variant, and we're seeing them in all age groups. So the public health guidance and the testing and isolation for someone with a variant of concern is exactly the same as for someone who does not have a variant of concern. But what the health unit will do, if someone tests positive for a variant of concern, we notify them so that they can notify their healthcare provider should they have any health concerns, or if they have anyone in their home who's maybe afraid to get tested, reluctant to get tested, we tell them, please encourage your family member to get tested because these can spread far more easily. So just wanted to kind of wrap up with a couple of things that we commonly see as case investigators in the community, just to highlight a few points. So testing too early can definitely be a concern that we see. So I mentioned that day 7 is the best time to get tested. So if someone is not having symptoms, we ask someone to get tested on day 7 or later. So day 7 from the last time they were in touch with the person who tested positive. Now, if you're being contacted by the health unit nurse will give you that information and tell you when your best date to get tested would be. What happens if someone decides to test before day 7 and their test result is negative? They may assume that they're fine and that they're negative, but it's actually too early. It could be a false negative. We need to know where that person is on day 7 or later. Also remembering at any time if someone develops symptoms to please get retested. We can sometimes see people who are waiting a little bit too long to receive medical care because sometimes they're thinking, wow, I was told to isolate, so I can't leave my house. So anytime someone is concerned about their health or the health of their child, please reach out to your family doctor. If you cannot get a hold of your family doctor and you feel, it's upsetting to you, you're nervous, you're scared, go to the emergency room, call 911, do what you think is necessary to get the care that you need. We are also continuing to see people going to work or school who are unwell or sick. Marielle touched on the what to do if your child has symptoms, the flow sheet that you can find on the Health Unit website. I would really encourage people to follow that. One of the points that Marielle made was that if someone develops symptoms, before they go to school, we want to know that they've either spoken to their family doctor who's given an alternative diagnosis or another reason why they're having those symptoms, or that person has tested negative for COVID. We're finding that isn't always happening. People are staying home, they're sick for a day, that's good. They think their symptoms are gone, they return to school, and suddenly they're sick again, and we find out they're positive with COVID. So really, everyone trying to focus on that flow sheet and follow the direction, and people continuing to have multiple contacts. Like Ashley said, the gatherings, you might have 10 people, and when the nurse calls and said, okay, we look at someone's infectious time and say, who have you been in contact during this time? Sometimes people can have 10 and 15 contacts, and then those contacts have contacts. So if someone becomes ill, the virus can really spread. So really encouraging people to follow whatever the current public health guideline is at the time, because we do know it changes now and then, and really trying to minimize the amount of contacts they have in order to minimize the spread, especially now that we're seeing a lot of these variants of concerns. I think it was Ashley or Marielle mentioned kids not sitting in their assigned seats on the bus. It probably seems like a simple issue for anyone else other than the school nurses who are trying to figure out what students we have to dismiss from the bus. So students are assigned a seat on the bus. We really encourage parents to ask their student, maybe, where is your seat on the bus, and are you sitting there every day? Because when we dismiss a group on the bus, if there is a positive child on the bus, we look at the seats around them to decide who is at risk of coming in contact with the virus. If we can't determine who the kids are sitting around, we have to dismiss the entire bus. And sometimes that does happen. And then finally, just being aware that the variants of concern are definitely out in our community. We have to follow the public health guidelines and try to prevent the spread of those variants.
Thanks, Karen. I'm just going to talk a little bit about some of the available programs that are in our community right now to support students that have been dismissed from school due to COVID-19. Recognizing that schools for a lot of students are a source where they receive a lot of services, and whenever we send them off whenever they get dismissed, they may not get access to those services they were getting while they were being in school. Right now, it's a little bit different because the online learning is for everybody, but food access is one of the issues that we were seeing when we were dismissing children. On a regular school year, the student nutrition program does provide meals and snacks in most of the schools in our region, and that's available for students for free to usually it's every day or most days during the week. So the student nutrition program has been able to secure some funding to provide gift cards for families that are affected by dismissals or that choose to do online learning instead of in person. The way that students can access or families can access the gift cards is mostly for the schools. It's through the principal. So the principal will have a list of families that they identified or that the families identified themselves, and they'll be able to make arrangements to send gift cards to the families, either for the families to pick them up or they're able to actually mail them. It does vary depending on each of the school because the principals will decide how they're managing the gift cards that they're being allocated by the program. The other way that families can access food while they're being dismissed from school or not doing in-person learning is through there's community hubs that have been set up that are distributing food boxes. And the boxes usually will include a mix of non-perishable food items, shelf stable, and depending on the location, if they have access to refrigeration, they will have also some dairy foods available for the families to take home. So I've listed the locations where right now they are available. They are always looking to expand for more, to find more community hubs, specifically now that kids are going. We don't know when kids are going to be returning to school in person. So they've actually been able to shift some of the funding that we're providing for the in-school snacks to buy more of these food boxes. So families can access these food boxes for free and essentially no questions asked. They just have to have a kid in a school age bracket.
We also know that when children are dismissed from school or in the time like now when they're learning online, that they can experience some loneliness, they can be stressed, they can be scared, anxiety can be higher. So there might be a greater need for some mental health supports for the families, for the kids. So we just have a list of a couple available options that are free for everybody. Kids Help Phone is an amazing resource. It is an online service for all youth aged 5 right up to 25. Youth can have free access to professional counselors and crisis responders through a variety of ways, which is a really big benefit for this service. A lot of kids might not want to make phone calls because they don't want to talk on the phone. Kids Help Phone provides service through messaging, chat, text, or phone calls. So there's a few different ways that youth can access these professionals, and they don't have to have a specific problem or an issue. They might just want somebody outside their family or outside their friends to talk to and listen, and that's perfect. So that Kids Help Phone is a really great service to promote to your families. And then School Mental Health Ontario. This is, they work in conjunction with the school boards right now. They have a website up. They do have resources that are available for parents and families to support children's mental health. There's some activity sheets. There's some resources in terms of fact sheets to provide family members information about things to watch for. So it's just a free site that you can gain some additional information on mental health during these times. Locally, we do have a couple other options that I've listed here. So the Teen Health Center has programs available for anyone aged 12 to 24. I included their phone number. The Regional Children's Center goes up for service until age of 18. And then the crisis hotline is just for ages 18 and over. So that's up to all adults as well. So if there's a mental health crisis, then that's a really great hotline. In addition, again, if somebody's at risk, their safety or their health is in danger, always remember that 911 is we promote that as well. So these are more like long-term. You can get assessed, you can join programs. Even if there is no mental health concern, Teen Health Center and Regional Children's Center do run programs that can help support children during COVID or outside of COVID as well. So all really great resources that we have locally.
And then lastly, before we open up the floor for questions, we just wanted to give you a list of, or leave you with a list of resources or and websites that you can access for information on COVID. So our WECHU website, wechu.org, that's our health unit website. That at the beginning of COVID was redesigned to have right on the front page all the information regarding COVID and the latest information and resources that the community could access. Right now, it's including information on vaccination. People can book online their appointments for vaccination. They can know who's eligible for vaccination. So all the information regarding COVID is available on our website. The cool thing from our website and the feature that we have, it was introduced in the last couple of years, was the browse aloud feature, which is, I think the icon, it looks like an ear to me, but you can click on it and you can select different languages. So it would actually change the content and read it out loud in the language that you selected. I believe that it uses the software from Google Translate to access the different languages. So the languages that we have available are as many languages that Google Translate will use. So it's a good feature. The other thing too that is available on our website is, and I know that Monica, you shared on the chat the resources that we have available. So if you go on our WeChat website and you type schools, you'll be able to access our COVID schools website, which has information for parents, information for educators, and posters and signs, and it's available in in a variety of languages. We have prioritized mostly Spanish, Arabic, French, and Somali as part of the languages that we are offering to schools as part of our standard package now. So you'll able to access those as well on our website and download it and share it with your clients. The other website that I wanted to leave with you was also the Public Health Ontario website. That's also a really good website for information on COVID and for handouts. It'll have the latest information on guidelines and specifically for schools. We actually, when we do dismissals, we use a lot of their resources. So you'll find information on how to care for a family member, how to care for somebody who's isolating. And that's very important, as Karen mentioned, for families that may have a COVID case and they're caring for somebody with COVID in the household, and how they can do that safely to prevent the spread within the household. So that information is available to download on the Public Health Ontario website, and it's also available in different languages. And then lastly, if people have questions, the first thing that we always recommend is for people to access our website. Our website does have a lot of information. It could be so messy at times. We try and keep it as clean and accessible as possible. But it does include all the information, and it's always updated, and we're always making sure that the latest guidelines and the latest resources are always available. So that would be the first place that I would recommend people access for information if they have any questions. If they if they don't have access to the internet, or if they can't find the information, the second thing that they could do is they could also call somebody. The health unit has habilitated. We have a variety of hotlines. So Healthy Schools has a hotline, vaccination has a hotline, workplaces, and then we have a general hotline for COVID. The issue with that is that we do get a lot of calls a day, to the point where I think right now we're not taking any live calls, so it goes to a voicemail. So people will leave a voicemail, and then we'll try and respond to them within 24 hours. But it really does depend on how many calls we're getting in a day. So that could be a little bit harder for people in terms of getting their questions answered. There could be a little bit of a delay if they're calling the health unit. Actually, I believe it's 211. Actually, that there's a little bit of a typo on the slide, but 211 is supporting the health unit in running our call center. So people can actually call 211 to get information on COVID and access to resources. So they also have a list of available programs and resources. So if people are looking for have issues with accessing food or accessing programs to support mental health, 211 has actually been supporting the health unit to be able and have a list of programs and resources that they can refer families to. So that's also a really good option for families and for clients to access. And then lastly, like I mentioned, general public health websites. It's very important that we are directing people to the right to get credible information. So Health Canada, Public Health Ontario would be the best places to get information, as well as the WECHU, the health unit. If they don't live in our area in Windsor and Essex County, they will have their respective health units. So if they live in Chatham, there's a Chatham health unit. If they live in Sarnia, there will be the Lambton County Health Unit. But we all sort of work with the same guidelines, and they'll be able to access the same information. And somebody said that 311 is the city of Windsor. Yeah, there was a little bit of a type of who is supporting us right now is 211, not 311. So that's correct.
We wanted to draw attention to really promoting like reliable resources for news around COVID-19, because there is so much There's so many ways to get other information right now, social media. There's a lot of, anybody can post their information on those sorts of sites. So we really just want to make sure that we're promoting reliable, credible locations for information to our clients and our community. So, I think that wraps us up. So we're going to open the floor to questions. I'm going to stop sharing my screen.
Yeah, so we wanted to open up the floor for questions. We've allocated like the last 30 minutes of our time together to answer any of the questions that you may have. I know that you submitted some questions ahead of time, so if some people are a little bit shy and don't want to unmute themselves, or they don't want to type, I can go through some of the questions that were submitted during the registration, but I'll maybe give a few minutes or seconds for people to submit their questions or unmute. You can also unmute yourself and then just ask the question.
There's one question in the chat that we can answer. When the schools hosted their asymptomatic testing sites, was there data released on this? Yes, there is. There's a web page through the ministry that goes through every single, it's done by school board across Ontario. So they did report exactly everything, all the numbers of tests that they did per school board, and then the positive cases that they found from that. So that is available to be found. Any sort of positive case that we found from that, I can tell you that locally we have had no positive cases come from our asymptomatic testing. Those would have been included into our daily positive cases, but we didn't have any. So you can find the full details of those testing outcomes on the ministry site.
Yeah, it was the Ministry of Education, for anybody who's wondering. Any other questions? Feel free to unmute yourself and ask it if it's easier than typing.
So in the chat, there's another question. Are there resources available in different languages or counselors who speak different languages regarding mental health resources?
I know that Kids Help Phone is available in French and English for sure. I am not entirely sure what our local resources offer, but I do know that a lot of people, like we have spoken with service providers who work with some of these organizations, like for example, the Teen Health Center. So they would have support for that. I am not going to say confidently what languages they support, though. I'm sorry. We can definitely look into that and get back to you if you would like to. You can private message me and just leave me your email address and we can follow up for you.
Hi, I'm Karen from SCCC. Just on the topic of interpretation support for newcomers, I know that at SCCC in our settlement department, it is an ongoing issue in terms of provision of interpretation for mental health, for counseling, for example, for family health services or other counseling. So it can be a barrier for clients that speak another language and who are looking for resources regarding mental health support, particularly teenagers. I just thought I'd add that.
I think I also wanted to point out when Karen was speaking, when they do the case and contact management, when they're talking to high risk close contacts or a positive case, they do have access to a Rio translation service. So they have it on demand on their phone. So when they're speaking to a client, if they find out whatever language is their preferred language, they can patch in a translator right through that call. Just so I know it's a little bit different than the mental health, but I wanted to bring that up so everybody knew that too.
Yeah, that's great. That's awesome. Yeah.
Question, sorry, regarding the food program. My internet was disconnected. It's just a food program for the student that's been dismissed from school. Is that like when they back to school, or it is available right now for them? Can you just give me more information about it?
Sorry, I didn't catch the first part. Which program was it?
For the food program or the food boxes for the students that have been dismissed from school or for the families?
Yeah, so they're available to access it while they're doing online learning, so while they're dismissed from the school. So it's two programs sort of running in parallel. So the student nutrition program will provide on a regular day, they will provide meals and snacks in school, but recognizing that some students chose to do online learning or for a variety of reasons are doing online learning or are being dismissed. Now that's why they have that gift card and food box program. So they're happening concurrently right now because schools are closed. They're not offering it in school, but families are able to access it while they're while they're doing their isolation, while they're completing their isolation.
Okay, thank you so much.
We had a couple questions that were submitted through registration. We've pulled those, so we can address a couple of them. I know that I think Mariel talked about this briefly. We had a few questions actually that were about the school situation right now. If schools will be closed until September, what do we say when clients ask when the schools will reopen and allow in-person learning again? And if the same safety guidelines will be implemented in the upcoming school year. So we are unsure at this time. These were provincial decisions and directions to help prevent the spread and slow the spread of COVID across the province. So we have not heard at Public Health what there is no timeline put for the return to in-person at this point. So unfortunately, we don't have an answer for that. We wait until the province announces it, and then we try to get that news out to our local community as quickly as possible. And as for the same safety guidelines moving into the 2021-2022 school year, so September until next year, I would imagine that many of the safety guidelines will still be in place. We will have to get our vaccine rates up, and we know that like COVID will still be here at that point. So we don't foresee a lot of these safety guidelines being pulled at that point. So things like the daily symptom check before going to school, making sure kids aren't going to school when they're ill, wearing masks, good hand hygiene, all those things, the hand hygiene, the physical distancing, those sorts of stuff. I would imagine they'll still be running through into the next school year, but we will have to wait and see for final confirmation.
There was another question. I think this one would be for Karen Fields as our public health nurse. But there was a question, Karen, on the different messages that they're getting in terms of how long they need to families need to, or the dismissed children needs to isolate for. So some people have heard 5 days to some 14 days, and they're asking why is there such a difference in how long they need to isolate for.
Okay, so the reason, so anytime someone has had close contact with a person who tested positive, the isolation time is always 14 days. Where the dates might vary, depending on, if you remember when I said when we look at the case, when we're doing the case investigation, we're looking to see when was the last time someone attended school. And if that happens to be, you know, maybe it's been a week since the person attended school, that person's isolation would still have started the date they last had contact, but they may only have a week left of isolation. So it's always 2 weeks long for someone who is identified as a high-risk close contact, but that break in contact date or that date of exposure is when the isolation starts. And often we don't always find out about them within a couple of days of break in contact.
Thanks, Karen.
You're welcome.
Any more questions? I know that I see a few questions on the chat about vaccine, and I believe our vaccine distribution managers also has joined the call. I saw her come in and out. Jen, are you there?
I sure am. Good afternoon,
Perfect.
everyone.
So I just wanted to introduce Jennifer Johnson. She is one of the managers in our school, Healthy Schools department, dealing with the vaccination portion. So on a non-COVID day, she will be doing the vaccinations, the mass vaccination clinics that happen in schools when we do for grade 7s and so on and so forth. But right now she is the person to talk to about vaccination and COVID vaccines.
And thank you so much. And I received, sounds like through the registration, I got a great list of some great questions. I'll just start off by saying that just recently in March, the Windsor Essex Community Health Center and the Windsor Essex County Health Unit collaborated together and hosted a couple of webinars specifically to answer a lot of questions that that a lot of the clients in our community were asking. And a lot of them were the same questions that came in through your registration. So those webinars have been recorded and they have been uploaded to YouTube. And I know that that WeLip is going to be providing those as part, like a link to those as part of the feedback survey that's going to be sent out. And so many of the questions that were posed, there's going to be a lot more fulsome answers. There's a number of staff from the health unit as well as from the community health center, including doctors and nurses who answered a lot of these questions. So I'm going to do more of an abbreviated version for you today, knowing that you've been very patient and it's been a very good session. And just answer some of those key ones. But we will provide you, for you as well as for any of your clients, links to the YouTube video, which is wonderful because it allows closed captioning can be changed and updated into many languages for clients. And as well, our health unit website has a lot of useful information, especially in the question and answer section under vaccines. And we also feature a software as part of the website that's called Browse Aloud. And if you're not familiar, it actually has a little icon that looks like an ear when someone visits our website. And that allows the text to be translated in multiple languages as well. So we have a lot of ways that we can get that information in more fulsome explanations to you as well as with your clients. So I'm just going to kind of go through some of the questions briefly and then some answers. And then if there's anything else, you guys can let me know. So one of the questions I saw a couple times was, is it mandatory to get the vaccine? And absolutely not. No one's forced to get a COVID-19 vaccine, but it's it's quite highly recommended. It's to protect yourself. It's to protect the ones you love. And so if you are eligible, then it's highly recommended for you to get it, but absolutely no one is forced to get it. And speaking of that, so there's lots of questions about who is actually eligible. And I will say that you've probably experienced this. The rollout throughout the province has been very interesting, and every day it changes. So I would first start by recommending that individuals, if you're wondering if you're eligible or not, to check the health unit's website. It's www.wechu.ca. And again, it includes that Browse Aloud. And there is a very large list of individuals, because every day it grows, of who is eligible as we get more vaccine in our area, and as well as we continue to vaccinate groups from a priority basis. The government sets, the Ministry of Health sets the priority groups and what order they go in. And then they work with our health unit to discuss what the local needs are as well. So just as an example, announced just this morning is an expansion of bookings for COVID-19 vaccinations that now include those that are 40 years of age and older who live in hotspot postal codes. So individuals where they live in postal codes that start with N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y. And all this is going to be on our website, so you don't have to remember it. And as well, they've dropped the age for those individuals that qualify, that have higher risk medical conditions. And there's a list of those on our website. So that is now, eligibility is now age 40 and over. And as well, childcare workers in licensed childcare settings across Windsor-Essex County are invited to also. So there is every day, more and more individuals are becoming eligible. We are also working on, and this was discussed briefly in the media, some pop-up vaccination clinics in some of those like downtown neighborhoods coming up next week as well. So lots of exciting opportunities, and we certainly want to reduce as many barriers as possible for anyone who wants to get vaccinated to have the opportunity to do so. And that includes making sure that there's language supports on site, and that many of the documents or information is provided in multiple languages as well for those in the community who have questions and want to have answers. So I would encourage you to go to the Health Unit's website or your clients, because there is a lot of now many groups, and it's being added to daily of who qualifies. And the reason that they have to prioritize right now is because we do have a limited supply of vaccine that will eventually, hopefully, expand, and then we should be able to vaccinate anyone who is looking to get a vaccine for sure. The wonderful thing also is that anyone who's looking to register has different options on how to do that. They can go to our website, and if they have access to internet, can actually book online if they're one of those eligible groups. There also is a call center that does support multiple languages, and that is listed on our website, but the number is 226-773-2200. And that's open most days, 8 to 8, Monday to Friday, and I think 8 to 4 on the weekends. So there's lots of opportunity that if anyone needs any help booking, that they're available to do that online. Another great question that came in was, can I get a vaccine if I don't have a valid health card, a valid Ontario health card? And an OHIP card? And the answer is absolutely. We want to try and reduce barriers as much as possible. And the government has made it very clear, which is wonderful, that that anyone can get vaccinated. They do need to present some form of government issued ID, but this could be a driver's license, a passport, a status card, other health cards from other regions, just something so that we do have a name and a date of birth and be able to match that person. And because we do have to register and keep track of who gets their vaccine. Another great question, which I think is very important, is are the COVID-19 vaccines safe? And many people have questions or concerns because they said, well, how could you develop a vaccine that quickly in just a year and a half? So the really amazing part of this is it was a worldwide collaboration on this. And for the first time in human history, there was a shared common economic, money-driven reason and health-driven reason for people to, researchers and companies, private and public and governments, to work together. So in this case, none of the quality, none of the checks, everything that normally is in place no corners were cut, nothing like that. The biggest factors, the biggest reasons why we were able to, as humans, to come up with a COVID-19 vaccine many years earlier than we've ever been able to make a vaccine before, is there's been a lot of advances in science and technology. There was international collaboration among scientists, health professionals, researchers, governments. There was a lot of money. And on top of all that, Health Canada, which is the organization that is responsible for reviewing evidence, reviewing information, and making decisions whether a vaccine is safe or not for to be giving to people. In the past, they have required that researchers provide all of the data from all of their studies at the end. In this case, the government, Health Canada, actually changed the process a little and allowed companies who were developing vaccines to provide data every single day. So they could look at the data as it was coming in instead of having to wait 3 or 4 years for data to come. So it really made things a lot easier. And it meant that the data could be looked at sort of in real time and be able to give feedback to the researchers. So there was a lot of factors of why the vaccine was able to be developed as quickly as it was. It is very safe. And as you've heard, if there's any concerns, vaccine is being they're looking at the evidence and making decisions to say who should get the vaccine and not. One of the great questions as well that came in was, what are the differences between the vaccines that are available in Canada? And so Health Canada has approved 4 vaccines right now. You've probably heard of them: the Pfizer vaccine, Moderna, the AstraZeneca COVID Shield, and then the Johnson & Johnson vaccine. And primarily in our region, we're getting Pfizer and Moderna. We do have AstraZeneca that's coming in through and distributed through the pharmacies as well. So some of the differences are who the vaccine is actually approved to be used with. So Pfizer, for example, is those that are 16 years of age and older, whereas Moderna, the product has been approved for only those that are 18 and older. And some of the differences also is Pfizer, Moderna, and AstraZeneca, they all require 2 doses. So a first dose to prime the body and get it ready, and then a second dose that we're seeing as more of a booster, whereas the Johnson & Johnson has been developed as a single dose vaccine. So those are just a few of the little differences between them. And I know there was a few questions about the types of vaccine, and I'm not going to go into too much detail because actually the webinar we talked a lot about it. But Pfizer and Moderna are a vaccine that's based on messenger RNA, which is a building block in your body. And it basically teaches your body how to make a protein or make something in the body that then your immune system can recognize and prime and get ready. So if it ever encounters COVID-19 virus in the wild or out when you're out at the grocery store, your body can actually fight off that virus because it already has the instructions on and recognizes the virus because it has those instructions in advance. The interesting thing about this is that it's not a newer technology. We've been working on mRNA or messenger RNA type virus vaccines since SARS. So a lot of people think, oh, this is something brand new. It's been worked on and been used sort of in theory and has been worked on in research for a long time. And this is the first time where we've used it sort of in a mass vaccine rollout. But the second type of vaccine that the AstraZeneca and the Janssen they're called non-replicating viral vector-based vaccines. So it's kind of a long word, but really what researchers did was they took a very harmless virus that's often used with animal vaccines, things like that, and they modified it a little bit so that it is actually able to get your body to also make antibodies. So there's no part of the actual COVID virus. It's not alive. It can't make you sick. So 2 different technologies, but both with the same effect. Like a viral vector-based vaccine, like I said, many of them were created for vaccines for animals, but also the Ebola vaccine was approved, and it was also a viral vector-based vaccine. So there's a lot of more technical stuff, but I think that's sort of the takeaway. The point is that that these are tested, clinically trialed, and there's been a lot of safety measures put in place before these were ever ready to be administered to anybody. There has been millions and millions of doses across the world now administered with very high safety and efficacy. And that was another question that came in: how effective are the vaccines? And so all the vaccines that have been approved to use in Canada are found to be very effective. And Health Canada determines if they're safe and effective. No vaccine is 100% effective. And you may have heard terms like some vaccines are 94% or 92% effective. The thing to consider, though, is that when you hear those percentages, it's kind of like comparing an apple to an orange because the studies are done at different times and in different locations. And so, for example, some of the studies in AstraZeneca were in Brazil and Africa, which is where we're seeing a lot of the variants. And so efficacy percentages might be a little lower. But when we're seeing it compared to Pfizer did a lot of their clinical trials before we had variants, and in North America, where we didn't have that at the time. So so really, honestly, the vaccines are all very effective. We're finding that, and what efficacy really means is that they do a good job of preventing us from either getting the virus, or if we do happen to get the virus, to have less severe symptoms. And so that's what we're finding is those people that have been vaccinated, even if they do get a little sick, they're not being hospitalized, they're not being put in the hospital, and they're generally not getting as sick. And consequently, there's starting to be evidence to show that they're less likely to pass it on because they don't have those severe symptoms of somebody who's as sick. I hope that makes sense. And then a question that kind of related to that as well is one brand better than another? And there is absolutely no recommendation of one brand being more better than other. For some, there's recommendations about, so for example, the AstraZeneca, a certain age group that that we're looking at. It's recommended that would be for, that would be different, but there is, not a lot of evidence about the length, like how long you're protected, but we do know that that all of 4 of the COVID vaccines that are approved for use in Canada are very highly effective at keeping people from getting sick and keeping people from spreading COVID-19 sickness. And I'm sort of wrapping up here because I know it's 3:28. A few questions had asked about the sort of side effects of getting the vaccine. Most reported side effects are very, very mild. A little bit of redness or sore arm is very common, and that's common with a lot of vaccines because you've just poked somebody with a needle. I know I had my Pfizer vaccine a number of weeks ago, and I had a sore arm for a day, and then I felt okay afterwards. In some cases, people feel a little tired, and that's also normal because your body is now being asked to mount sort of an immune response to get their immune system going, and so that takes energy, and that takes energy away, and so people do find that they can get a little tired. Some people experience small headaches, some muscle pains, chills, joint pains, and then fever in about 14% or so. Again, all those are very common. We don't recommend that anyone take any medication, to prevent pain or anything before getting vaccinated. But afterwards, you can take Tylenol if you're feeling a little soreness. That's pretty normal. And then one of the questions people had was, do families have the choice to choose which vaccine is administered to them? Which is a great question. So currently in our region, like I said, there's the 3 vaccines. Different clinics, most of the time will have Pfizer or Moderna, and the pharmacies generally have AstraZeneca right now. Like I said, the most important message here, I think, honestly, is if you are eligible, we really recommend everyone get vaccinated. And that's a great, so I just saw there's a question here, why wait in Canada between 2 doses? So you're absolutely right. Based on the fact that what research coming out of countries that have done large vaccinations like Israel, Ireland, the UK, what the research has found is that after the first dose, the majority of people have such a good response that they're covered very, very well after the first dose. And so the many governments, including the UK and in Canada, chose, based on the research, based on the evidence coming out, to try and vaccinate as many people with the first dose because of the limited supply of vaccine, so that more people are covered, and then the second dose is more like a booster. And so that's why that extended interval was put into place to try and provide as many people as possible with the opportunity to get a good amount of immunity with that first dose. No, because so one of the questions here is about choosing which type of vaccine. Honestly, they're all excellent. And it really would be about, if it's available to you, you should get vaccinated. That's the number one, that's the message for sure.
And that's a great message, Jennifer. And I know we're now 1 minute over time. Thank you for, sorry, I don't want to.
Oh, I was just going to say I think, so honestly, the webinar has a lot more great information. I think I've sort of hit on a lot of the key questions, and also the health unit's website that'll be, so thank you for the opportunity, and I look forward to, yeah, wonderful. Thank you.
Absolutely. And we will certainly, you'll be getting information from WeLip shortly, including a link to the vaccine information webinar that was held recently, as well as links from the health unit's COVID FAQs. And you'll be getting a survey from the LIP too about this information session. It really helps us to know, we're hoping to do more of these, so to know how this went and what you're interested in hearing more of. And based on the questions, I think vaccines are always at the front of everybody's minds, and with no doubt about it. I want to say thank you to Karen and Ashley and Mariel and Jennifer for joining us today and sharing some really, really awesome information. I hope we can do it again. I appreciate everyone taking the time today to join us and to learn. And please feel free to reach out. Again, the health unit's website is full of wonderful information. The LIP will continue to share and promote all the programs that the health unit is offering, and hopefully we can do more of these down the road. So thank you, everyone. Don't forget to fill out your survey. You'll be getting it in about 7 minutes. Have a great afternoon. Thank you.
Thank you.
Thank you.